Anyway, I can tell you what I did, and then maybe you will talk because you realize that you have much better ideas. The way I look at it is as follows, is I try to understand first what is the nature of the problem. This is what has changed for me a lot in the last 1 year. So I give now a lot of importance to the nature of the problem. Patient is saying a lot of things. What exactly is he saying? What is the main issue? Now this main issue in the case is what would be called by Boger as the generals or Bonninghausen or Fatak. He would call it as the essence of the remedy or essence of the patient. By essence, is slightly different from what Vitulkas would call as essence. So I'm not talking about a more psychological approach, but a more general approach. What exactly is the issue in this case? The nature of the pathology. And I think this needs to match exactly, and then we can see what are the themes of the case and which remedy has those themes. So this is what has changed in a very big way for me, and that has made my life a lot easier, I tell you, and the results are much better. So what is the nature of this case? He says, I have this and that, but my body aches continuously. I cannot stand. I am never fresh. I am always tired. I am losing confidence. I am losing control. I am going to fall down. As if I can't hold something, as if it will fall down. I am so tired. I am so shrinking. So the nature of the pathology is fatigue, tiredness, weakness. That as if his muscles, his bones, his brain, everything has become tired, has become weak, has lost its strength, its capability. This is the general idea of everything. The Gaurang, what did Boger call it? The red thread, or what is
the genius.
The genius.
Genius to the remedy.
The genius of the remedy or of the patient is tiredness, fatigability. So what I want to look for in the materia medica is a remedy that has as its very center, its very core, its very essence, fatigue, tiredness, weakness, falling, exhaustion. Do you follow me?
Yes.
This is how I am thinking nowadays. And then life becomes easy, because immediately your mind knows a few remedies that has that, and then when you see the themes of those, one of those remedies in the patient, it's a, like, the sound of two hands clapping. This is how I think. So you see that on one side, and then you ask him, so tell me about this, and then he takes you into that I cannot concentrate, I cannot communicate, I cannot think, I cannot innovate, my confidence, my capability, my career. So we are talking of the mineral kingdom. Because he is losing his capability or his capacity to what? To innovate, to communicate, to use his voice. He is losing control on his voice. And a lot has to do with voice, isn't it? With speaking. He becomes tired on speaking, he trembles on speaking, the voice does not come out, he becomes anxious on. So his first, and when you put 2 and 2 together, then straight away you know that in sternum, the first modality of sternum is what? is from using voice. That's the first modality of stenum. And you know very well that stenum is in the fifth row of the periodic table, which has to do with creativity, innovation, new communication, performance, speaking. And his main feeling is that he has lost it. He is a failure. He wants to resign, give up. He has lost the capability. So that is coming in stenum. So if you look at stenum mind, you have the feeling, the first symptom that says is very sensitive as to what others say about her. This is what he said when he went into the meeting. He was always conscious, what are people going to say about me? And anxious, very anxious, nervous, miserable and discouraged, taciturn and dislike for society, hopeless and despondent. Feels like crying all the time. This depression is very, very strong there. So once this and this comes together, because the main, you can see, if you see the generalities of stenum, the main idea of stenum, it says it is on the nervous system that causes extreme weakness. The patient feels it in the chest, in the upper arms, in the thighs. He says, it's as if I have run a marathon, as if I have climbed 200 floors. That kind of exhaustion, that's what I feel in my legs. That is the sensation. That he cannot talk. He drops into the chair instead of sitting down, trembles on moving. It's a paralytic heaviness or weakness. So this weakness is a nervous weakness. It's a weakness of the nerves. Therefore, any anxiety makes it worse. And then, of course, the great symptom of stenum is pains increase gradually and gradually subside. So then he said, my only past history was that I had a lot of abdominal pain for 5 years. So then I thought it's a good idea to go into the abdominal symptom. And I started looking up if stenum has its symptoms. And indeed, this is all the symptoms I found of stenum. So you had this pain ameliorated by pressure, bending double, worse from eating, pain in abdomen increasing and decreasing gradually, pain in the night with restlessness, hard stool, distension on the right side of abdomen, flatulence after eating, flatulence obstructed. Flatulence pressing on abdomen ameliorates, concentration difficult, despair from exhaustion, dreams of misfortune, and prostration of mind from talking with trembling, wants to rest and repose. He must rest and repose. There's only 15 remedies here in this rubric. Must rest. Standing aggravates. And Jan Scholten writes, empty, weak and drained. Everything is coming to an end now. They have lost control and can't do much more. This makes them weak and feeble, makes them feel empty, as if all life has drained away. That's what he experiences now. So I gave him 1 m of stenum. क्या है?
सर इसमें पढ़ना तो एंड का पार्ट.
Read.
Okay, so I'm reading from the forward of Bogus Synoptic Key, last paragraph. The strain which runs through every pathogenetic symptom complex has been called the genius of the drug. To give this its proper place in prescription should be the ideal of every prescriber.
That's exactly the main idea. The strain that runs through every pathogenetic symptom of the patient and the remedy, we can call as the genius of that patient or remedy. And that should be given its proper place. That will make your prescription successful. If that is missing in the prescription, it will be a failure. I gave him sternum metallicum 1M because he is very much at a general level. All his mental, general, delusional, energy, everything. And I gave him for 2 days, morning, evening. And I expect that by Tuesday, this man will be at least 25% better in everything. And that's why I've asked Rishi to take a follow-up, and he will tell us on Tuesday about Thuja and about sternum. Yeah.
Your experience with the genius, has it in some way changed your way of case taking?
It has made it quicker because I use the things together now. But what the genius thing is the anchor for me. I must have a remedy that has that central core of the patient in it most prominently, equally prominently. Where is that quotation?
I'll get it.
Get it. And if that is the anchor, so I must have a remedy which has that as its center. The center of the patient must be the center of the remedy. If the center of the patient is weakness, fatigability, exhaustion, which is nervous, the center of the remedy must be that. And then it's easier with the sensation, with the rubrics, to come to a remedy. That's why my cases don't take more than half an hour, 40 minutes. It's made it much, much easier and much more sure. Much, much more sure. My confidence level with this is very, very high. I tell the patient, you will be all right. There is no doubt. I couldn't do this before. I'd say, yes, maybe, maybe not. Of course, it doesn't work, but at least you are confident. That's a big step, isn't it? Earlier it didn't work and there was no confidence. Now it doesn't work, but you are confident. Yes, it will happen. Sometimes it works. What do you think? Do you agree? Sternum good?
Yes.
You had some other ideas?